Good morning, everyone. It's a pleasure to be here today, and I'm delighted to be moderating our first panel on what do family caregivers experience, want, and need. I want to note, and we're awaiting Kathy Kelly. I'm not sure exactly where Kathy is, but she hopefully will be here momentarily. She's in the vicinity. She's in the area. I just wanted to take a moment to note that myself, as well as our three panel members, are all women. And I wanted to acknowledge that we are well aware that men, at least a third of men, are family caregivers, and we will be addressing their issues in the future, as well as the needs of multicultural family caregivers. But today we have an exceptionally knowledgeable panel, three experts who know firsthand what family members and friends experience profoundly when caring for an older relative or friend who has multiple chronic conditions and functional limitations. In the interest of time, I'm not going to introduce our esteemed panel formally because their bios are in the packet, but let me just say a few words about each of them. Our first speaker, Kathy Kelly, who I'm hoping is going to walk in momentarily, is the Executive Director of the Family Caregiver Alliance in San Francisco. Family Caregiver Alliance was the first community-based nonprofit organization in the country to acknowledge the needs of families caring for loved ones with adult-onset cognitive impairments like Parkinson's or Alzheimer's disease. Since 1977, Family Caregiver Alliance has worked through education, advocacy, policy, and research to elevate into public visibility the challenges that families face in their caregiving roles. And I had the opportunity and pleasure to work with Kathy at Family Caregiver Alliance for over 2 decades. Kathy, when she arrives, will provide an overview of what family caregivers say they want and need. Our second speaker will be Carol Levine, the director of the Families and Healthcare Project at the United Hospital Fund in New York. Carol is a prolific and a gifted writer. She has contributed enormously to the national discussion about the difficulties and the emotional truths of caring for seriously ill loved ones. She focuses her work on developing partnerships between healthcare practitioners and family caregivers, especially during transitions of care. And for 17 years, she cared for her husband, Howard, who had been seriously injured in a car accident. Carol's going to be speaking about the findings and implications of the groundbreaking study, Home Alone, that she co-authored with Susan Reinhardt from the AARP Public Policy Institute and Sarah Samus from the United Hospital Fund. And our third panelist is Kathy Kenyon, a policy expert on health law and policy. Currently, Kathy is a senior policy analyst at the Office of the National Coordinator for Health Information Technology in the Department of Health and Human Services. But Kathy is speaking to us today as a daughter and as a family caregiver from the perspective of someone caring for both of her parents with dementia. She submitted for the record a compelling and a constructive statement about her caregiving journey and her dedication to both of her parents and their quality of life. I hope she'll be addressing some of the important policy and research recommendations that she made. In full disclosure, I will say that Kathy is married to one of my coworkers. So without further ado, I'm going to turn it over to Carol Levine. Thank you, Carol.